In the concrete jungles of our modern cities, a silent but deadly war rages against our health. The air, a fundamental essence of life, has been weaponized into a toxic concoction that escalates the incidence of heart disease, strokes, and cancer. The grim toll is unequivocal. Air pollution claims 7 million lives each year. In the thick haze of New Delhi, taking a breath is tantamount to smoking 7 cigarettes a day, potentially slashing lifespans by a dozen years in the most polluted zones. This health crisis is not confined to one city or nation. It casts a shadow over global life expectancy. The most defenseless among us, children in polluted metropolises, are inheriting a legacy of health risks, with their developing lungs subjected to the toxicity equivalent of tens of thousands of cigarettes by the time they reach adulthood. Pollution magnifies the dangers already posed by smoking, obesity, hypertension, and diabetes, layering an additional threat upon those with these predispositions. The polluted air compounds their susceptibility to grave health complications. Invisible assailants saturate our atmosphere. These include particulate matter, or PM2.5, volatile organic compounds, and insidious gases like carbon monoxide and nitrogen dioxide. These agents can infiltrate the human body, penetrating the defenses of our lungs and blood, precipitating a domino effect of health hazards. Inhaling this corrupted air sets off oxidative stress in the lungs, sparking asthma attacks and respiratory infections. This oxidative stress doesn't stop there. It spreads, laying siege to the cardiovascular system, inciting a series of ailments that can culminate into heart attacks and strokes. The implications for healthcare systems and economies are dire and immediate. Without intervention, the financial and health costs of pollution-related diseases will overwhelm global infrastructures. Pollution is indiscriminate, affecting individuals across all stages of life. Newborns in polluted cities are thrust into a world where their health is comprised from their first breath, a stark indicator of a dire health emergency that demands an urgent response. Yet the collective will to address this crisis seems paralyzed. Where is the resolve that we've mustered against other health emergencies? It is imperative to mobilize now, with vigorous policy shifts and community action, all focused on eradicating air pollution. The Lumen Foundation stands at the vanguard of this critical fight. We affirm that clean air is not a luxury, but a fundamental right. We are galvanized by the urgency to reclaim our atmosphere, for the sanctity of our health, for the legacy of our children, and for the future of our planet. Our present endeavors will sculpt the health landscape of tomorrow. We are united in this pivotal moment, demanding action before our healthcare system collapses under the weight of pollution's impact. The time to act is now, and our resolve is unshakable.